Bob Michaels is our 1998 visiting professor, and we're fortunate to have him here this morning to gain some of his understanding and knowledge about psychoanalysis and learn something about him. Bob, we're just delighted to have you. You've been here almost a week now, and I understand that you have made over a dozen presentations, and you're still smiling and
it's because I'm about to leave.
And I understand that you have interested, enthralled, and inspired the people who you have spoken to. And I'm not very surprised about that because you are one of the few people in our field who has had accomplishments in a number of disciplines. Psychoanalysis, psychiatry, academic medicine, and academia. And from what I know of you, you have this wonderful capacity to bring together and integrate and coordinate diverse ideas and come up with something that is understandable and useful to people. And you're wonderful on your feet. You have been an inspiration to many of the people in Michigan, and we feel really very, very blessed to have you here. Since it's not my interview, I better let you talk. About 10 years ago, you wrote an article for the Quarterly entitled "The Future of Psychoanalysis." And you help the reader think about this by dividing psychoanalysis, initially as Freud did it, as a treatment, a theory of the mind, a mode of inquiry, and a research discipline. You added to that that it's a profession and a powerful force in society. So now, 10 years later, tell us, how do you see our future? Where are we going to be 10 years from now? What do we have to do? What are some of the problems that we are going to be confronted with?
Big question. And you pick a specific time frame, 10 years from now.
Or let's make it 20 years from now.
Let me go back and forth
All right.
over that 10 years. I think that psychoanalysis in 1998 is alive and well and vigorous and has a very exciting and promising future. It's sort of a watershed year. We're really just starting our second century. People date the beginning of psychoanalysis at various times, but for me, if you had to pick a single day, it's probably that I think it was October 1897 when Freud writes Fleece the Letter, revising his first version of his trauma theory and really converting psychoanalysis from a theory of the impact of the world on the individual to a theory of mental life. And so the 100th anniversary of that was a few months ago. It was October 6-7 months ago. We're starting our second century, and there are important challenges. As a theory, it seems to me that we've matured so that there's a very comfortable, lively, vigorous intellectual dialogue about competing concepts and models, different approaches. So in the early history of psychoanalysis, there was a tendency to be concerned about anyone with a different idea and to throw them out of the field. And we had schisms, and people were labeled deviant, and we lose Adler, and we lose Rank, and we lose Reich and such. In the current dialogue, it's not fashionable to say somebody isn't really a psychoanalyst because you don't like his idea. And we've become immensely pluralistic with people who wouldn't have been read in U.S. institutes 30 years ago being invited to give plenary addresses today. Kleinians and Cahutians and Lacanians and intersubjectivists and narratologists and interpersonalists, etc., are all part of a lively intellectual dialogue. And I think that's good for the field. I think that there may have been a time when we were in danger of losing our identity because of a loss of our core beliefs. I think there's a much greater danger now of becoming too insular and losing the excitement of the dialogue because we refuse to listen to others. If we don't have the sense that there are important new ideas yet to be thought, then bright young people would be foolish to enter the field. And I think we do have that sense, more now than we have at any time in the last decades. As a theory of psychology, I think we've probably become much more modest in our view. I don't think very many people in 1998 would think of psychoanalysis as a general psychology. I think we'd see it as having a specific area of psychology to talk about, mental life. I think we'd recognize there were other appropriate and fascinating areas of psychology that psychoanalysis doesn't have important things to say about. And I think that there'd be a growing belief that the core knowledge of psychoanalysis doesn't have to do with human psychology, but with the therapeutic process. That we've shifted our focus from psychoanalysis as applying a psychology to the clinical situation to psychoanalysis being the science of the clinical situation. To me, that makes us much more comfortable because we were in the awkward position of claiming to be experts about something we never studied directly, such as early development. What we study directly is what happens in our consultation room. And I think growingly, our science is about the clinical process that happens in our consultation room. As a therapy, I think that the clinical dialogue is exciting and lively. I think we're increasingly being challenged by the world about us that if we claim to help people, we have to demonstrate it. And I think that's quite reasonable. It seems to me that it's, although difficult and expensive and time-taking, there's no inherent problem in testing the efficacy of what we do. And I think in a world that wants everything proven before it will put resources into it, we're going to have to demonstrate the efficacy of what we can do. I think the prospects here are for an exciting era of clinical research in psychoanalysis. The tools and methods are being developed. It's clear that most of the rest of psychiatry has focused on short-term studies of treatments aimed at relieving symptoms. It's clear that most of our patients and most of their patients have long-term problems in which the most important concern is not the symptom, but the impact on their life. And we're going to have to join with and maybe lead psychiatry in developing tools for measuring the long-term impact of a treatment on one's quality of life, rather than the short-term ability to diminish anxiety or depression or panic or whatever. But psychiatry needs those tools outside of psychoanalysis, so we can join forces with them, and then it ought to be doable to compare different patterns of intervention. I feel confident that all the early indications are we'll do very well in those comparisons, and I think that might help heal some of the historic tensions between psychoanalysis and other treatments used in psychiatry. The research community in psychiatry was surprised and fascinated when the early tests of psychotherapy and pharmacotherapy in the treatment of depression showed that the pharmacotherapy was roughly equivalent to the psychotherapy, but not better. And I think the psychotherapy research community was surprised as well. Those are interesting studies, clearly first generation, and do little more than demonstrate it's possible to do the studies. We're going to have to show what long-term psychotherapy does, what happens when the indication is character structure or personality disorder rather than a symptomatic psychiatric syndrome, and what happens when the outcome measures are the ability to love and work and play rather than the relief of symptoms. But I think we'll see those studies in the future. The profession. We're going through a transitional crisis, and something isn't quite clear. Historically, particularly in this country, psychoanalysis has been a subspecialty, first of psychiatry, then increasingly of psychology. It seems to me that we're at the beginning of a dialogue on whether there's an independent profession of psychoanalysis. Institutes are increasingly considering candidates who aren't fully credentialed in psychiatry or psychology. People are psychoanalysts with relatively little identification with their primary discipline before becoming psychoanalysts. But our educational system isn't adequate to fully socialize a health professional. It's largely part-time, usually night schools, not in Detroit, I know, and most of our students are doing something else while they're students, and if they haven't established a professional identity in their first profession, they're going to have trouble getting it in their psychoanalytic education. I think we're going to have to grapple with whether it's best to remain a secondary subspecialty of one of the mental health specialties, or whether we want to try to create a new kind of human care specialty which isn't derivative of medicine or psychology. I suspect that's going to be an important issue in the next few decades. I'm convinced that the future of psychoanalysis will be marked, as the past has, by having our leading scholars and intellectuals once every 10 to 15 years announce that psychoanalysis is dead and that Freud is over and that the era has come to a close, and each time there'll be a recognition that anyone who dies every 10 years for 100 years is a very important social force.
What more about analysis as a social force, particularly at the current time, where our survival is going to be dependent upon how well integrated we get into social processes?
Well, psychoanalysis is in a way a funny profession. I mean, there are a few thousand psychoanalysts in the United States, and the average one probably has 4 or 5 patients in analysis. That means in terms of the direct impact of the conduct of psychoanalysis, it's a trivial social force. Its real significance has been in its secondary impact. So although there are only a few thousand psychoanalysts, psychoanalytic thinking is the dominant paradigm of psychotherapy in the United States by psychiatrists, psychologists, social workers, and others. Also, psychoanalytic thinking has been immensely important in enriching the work of those who work with infants and young children in educational settings, of those who in the law, of those who are concerned with social organizations that care for people. It's shaped our attitudes about adoption. It's had an impact on our theories of education. It is one of the systems of ideas that molds our notion of what society should be like and how it should take care of its members. It seems to me that's been its more powerful influence. It influences the way we enjoy works of art, the theater, or our movies. It is a theme of our culture. Yet its core ideas and its new ideas come from that small group of people who are psychoanalysts, and although the practice of psychoanalysis may not be its greatest impact clinically, it's certainly been its most creative and a vibrant source of new thinking. So in some ways the social justification for what psychoanalysts do is almost more as a source of new thinking and new knowledge for all those other people who apply psychoanalytic ideas, as much as for its direct impact on the patients who are treated. But of course, it isn't funded that way. You don't get a grant from a government agency to psychoanalyze patients because the thoughts you'll have and the papers you write will be valuable to others. How to maintain that balance, how to keep the psychoanalytically informed world enriched by new ideas and continue to maintain a group of people who know and understand and practice psychoanalysis and generate those ideas is the short-term problem for the profession. Right now, the competition with other kinds of therapy providers and the constraints of the economic structure of the healthcare system have made psychoanalytic practice more problematic in some parts of the country than it's been in the last few decades. And that's, I think, had a somewhat chilling effect on some people's interest in applying or entering psychoanalytic careers. I think those are short-term problems, maybe a decade, but short-term problems can be scary.
You emphasize the need to validate what we do, particularly in terms of our relationship to psychiatry and science and the whole academic world. And yet, psychoanalysis, if anything, is a science of subjectivity. So it would seem to me to get into this whole arena of validation, what psychoanalysis can offer science and maybe help modify scientific approach is our familiarity with how to do research on subjectivity, on an individual's experience of things that are going on. Do you have any thoughts about what we can offer science?
Yes, I see the problem a little bit differently myself, I think. I think there's been a lot of, to me, the word that I'm struggling to find a synonym for is foolishness, but I won't struggle. A lot of foolishness in this area. I think that there are a group of somewhat naive philosophers of science who criticize psychoanalysis for not being scientific. And what they've said is we employ hypotheses or have beliefs that either we haven't tested or that are untestable. What they're usually referring to is the psychology of psychoanalysis. They're also talking about the validity of some of our reconstructive hypotheses or of our conjectures about cause-effect relationships between early life events or unconscious fantasies, subsequent pathology. I don't think it's sensible to try to do scientific research on those questions. I think the work is boring, and I think the results are of no value. I think that we have sometimes even more foolishly tried to defend ourselves from some of those attacks by arguing that we're scientists too, and we have different canons of science. It seems to me that the clinical work of an analyst involves using interpretations and insights and metaphors in order to help the patients do something. Whether the notions that inform those interpretations are valid or not isn't important. If the patients don't get better because of the interpretive work, what difference does it make if the interpretation is valid? If the patients do get better, what difference does it make if it's not valid? It seems to me, however, there's a second set of questions, which are traditional clinical research questions, which can be asked rigorously which can be evaluated with sophisticated methodology, and which give true-false answers. So I can ask, does this group of patients do better with an interpretive approach based on a ego psychology model, a Kleinian model, a self-psychological model, given with these parameters of the treatment or those, without regard for whether the interpretations in those models are true or false? The question is one of the outcome. Just as you can evaluate a pill without understanding the physiologic effect that that chemical has in the brain, the question is, does it help people who take it? The clinical research question is, does our treatment work? And that can be asked and answered without asking the basic science question of, are the concepts it's based upon true or false? If the treatment works, there'll be a great deal of curiosity about the concepts. But frankly, even if the concepts turn out to be false, we're not going to stop using an effective treatment. And if it doesn't work, it's not going to be saved because some of the concepts are true. I think we haven't done the clinical research on does it work, and I think all the psychiatric community is reasonable to request is that we demonstrate that it works.
You have written that with this more pluralistic approach to theory and the depolarization that has occurred in this last decade, we're going to see changes in the way we do psychoanalysis. So we have the depolarization, what changes do you see?
Well, I think you're seeing one change, a very powerful one already, which is the recognition that there's value in the de-authoritization of the analyst in the analytic office. The analyst was perceived as an authority, and the analyst is an authority. But the question is, what is that authority about? There was a time when the analyst was an authority about life, about what was healthy and what wasn't. I think very few analysts would hold that position today. There was a time where the analyst was an authority about psychology and how people got the way they are and what were the childhood forces that led to what adult constellations. I think most analysts still believe that that's part of their authority. I don't. I think that's rapidly diminishing, and we'll see that diminishing as well. I think what the modern analyst is an authority about is how to conduct an analysis, how to help the patient look at himself or herself, how to reflect about associations or dreams or fantasies or transferences. That the analyst is an authority in the process of clinical discovery, not in knowledge of psychology borrowed from outside the consultation room, and certainly not in how to live one's life in the world. I think that's a real shift over the last few decades, and I think it changes the climate in the office. It changes the symmetry between analyst and patient, and I think is also going to diminish the discomfort that society has had with the old-fashioned analytic notion being linked to a comfortable social attitude toward who doctors were in 1895, but not the dominant social attitude about who a doctor is in 1995. So I think it keeps us in consonant with our society as well as reflecting analysis more accurately.
One of the avenues that we need to develop expertise in is in bridging our efforts with academia. One aspect of it, and research, one aspect of it is neuroscience. And in some of your writings on this, in terms of our dialogue with neuroscience, certainly its importance, you've conveyed that possibly we don't have the right language yet I mean, we have two languages, and we're trying to fit them together, and we're not there yet in terms of mind and brain to talk to one another. So tell us something about that.
You've stated my view more clearly than I'm going to be able to state it. I think I'm a minority view on this one. I think there's a lot of enthusiasm in the psychoanalytic community for the thinking of contemporary leaders in neuroscience and for the possibility of building bridges between psychoanalytic thinking and neuroscience. A sort of feeling that Freud was too early with the project, but now is the time to pick up the task of the project again and do it better and enrich both fields. And it's exciting, and there are some fascinating things happening in modern neuroscience, and the dialogue is immense fun. And you've had some leaders of our field trying to build those bridges. Mort Reiser in a couple of books. Leaders in neuroscience. Eric Kandel had a paper a month or two ago in the American Journal of Psychiatry urging analysts to attend to this. I find it premature. It seems to me that we are interested in mental life, and the neuroscientists are interested in how the brain works. And there obviously must be major ties between these. But the neuroscientists are barely able to discuss how you remember a syllable or perceive a visual image. And it seems to me that the first bridge has to be between neuroscience and very simple cognitive psychology, not our immensely complicated subjectivist approach to mental life. At the same time, our first bridge has to be from psychoanalysis to cognitive psychology, not psychoanalysis to neuroscience. I think it wouldn't make much sense to... I'm sure that neuroscientific ideas have to be integrated with molecular biology and fundamentally structural biology. I think it'd be kind of silly to try to build bridges between structural biology, organic chemistry, and psychoanalysis, although Freud toyed with it. I think it's premature to build a bridge skipping the middle island, which is elemental psychological processes like perception, memory, cognition, which neuroscientists still have only the most primitive things to say about. So I think there's going to be a time, but we're not there yet. And I think in our enthusiasm for that broader link, we're not paying enough attention to linking psychoanalytic notions with psychological notions. That work has to be done.
You've had a splendid career in academic medicine. You're a former dean of a medical school, psychoanalyst who's a dean of a medical school, the chair of the Department of Psychiatry at Columbia, and making important contributions to those fields, and certainly a major force in American psychoanalysis. It would seem to me that an academic life for a psychoanalyst is extremely important for our field, and over the last decade there have been less and less. But you stuck in there, and you've maintained yourself with a few others. Tell us about something about this.
Well, a few decades back, psychoanalytic psychiatry was the dominant theme in academic psychiatry. And you had psychoanalysts as chairs of many of the major departments of psychiatry around the country. And the psychoanalytic model was probably the dominant paradigm in the teaching of psychiatry in the best programs. That's not true now. There's still a few psychoanalyst chairs, and there's some interest in psychoanalytic thinking, but it's become one of the specialties in psychiatry rather than the architectonic system in which all the other subsystems fall into place. There have been dramatic changes. Symbols of the changes are the growth of modern psychopharmacology, the growth of neuroscience interest, the nosologic developments around DSM-3 and 3R and 4, and the immense success of empiricist psychiatric research. Today, in American medical schools, psychiatry is the second most well-funded research department. Only medicine has more than psychiatry around the United States. And that's a dramatic change in a few decades. At the same time, the psychoanalytic community often feels mistreated or abandoned or rejected by the rest of psychiatry. I think that's a pathologic response. I think it's wonderful that psychiatry has developed so gloriously. I think our new treatment developments in psychopharmacology are an immense gift to society and an immense advance for the field. I think our neuroscience developments are amongst the most exciting in modern medicine. I think the growth of systematic empiric research in psychiatric epidemiology and diagnosis are both fascinating and, from a social value point of view, wonderful. And it seems to me that the psychoanalytic community has almost, and I'll parody this, has almost acted as though if they can't be in charge, they're not sure they want to play. And I think that's unfortunate. To give an example, in my community in New York, there are leading world-famous psychoanalysts who are immensely gifted, prestigious, and important in psychoanalysis, who are not on the faculty of any medical school and never teach medical students. I don't know of another specialty in medicine where you could find leading figures who have no medical school appointment and never do any medical school teaching. And I think that says something we should be concerned about. I think that the psychoanalytic community has at times acted as though work in the broader area of medicine and health is somehow raises suspicions about whether the individual interested in that is, quote, really an analyst, close quote, or not. And I think that attitude has been a major problem for psychoanalysis. I think that the psychiatric community would embrace psychoanalysts interested in participating in it. I think that our departments of psychiatry are searching for academically oriented psychoanalysts who are interested in empiric studies and systematic research. And I think the future of psychoanalysis requires that it examine what within the structure of the psychoanalytic world has had a negative effect on the development of such people and the advance of their careers.
That's very good. I don't know if you have anything that you can say about this, but you were a psychoanalyst. I'm intrigued with that. You was dean of a medical school.
With a couch in my office.
With a couch in your office, a prestigious psychoanalyst, psychiatrist as a dean of the medical school. What was that like? Can you say anything about it?
Well, I enjoyed it. My entire career I've had an academic position and practiced analysis and done both. I have always enjoyed the mix in my life. I would say that many, probably most medical school deans continue to spend some time in their area of medical practice. I don't think it's a good idea to have the dean of the medical school no longer be a doctor. And most deans are internists or surgeons or pediatricians or psychiatrists or whatever, continue to practice their specialty in medicine. In some ways, one of the easier medical specialties to practice part-time is psychoanalysis because of the way our time budget works. And all the students knew I saw patients regularly, and I think that was good for the medical students to know I was a real doctor. And I made rounds in the psychiatry department, and the residents knew I was a competent clinical psychiatrist. I supervised. I think that's all important for being a good dean. I had interesting and funny experiences with patients. When I first became dean, some of the patients that I was treating and that I continued to treat knew about the change in my role. I changed offices. There was a sign on the door. And some of them had fantasies that my new role would be one of such power and importance that I'd no longer be interested in them. And one of my very astute patients quickly noticed and commented that I was clinging to my role as psychoanalyst with her in order to have the enjoyment and security and comfort of something I felt good at, to soothe me from the pains of my new and at times intimidating role of being dean of the institution. So I would say it was a interesting mix. I don't think presented a problem in either role, and I think if anything, each role enriched the other. I'd be more concerned about a psychoanalyst who spent 10 hours a day, 5 days a week doing nothing but psychoanalysis, beginning to lose some sense of the rest of the world than I would about a psychoanalyst who spent half of his time as chairman of a department or dean of a medical school or a member of a faculty or consultant in a community agency or a teacher in a university or worker in a prison system or whatever else. I think having a mixture of roles in which you have contact with people enhances that part of your time when you're doing psychoanalytic work.
One of your claims to fame in this community is that you were the son-in-law of Edith and Richard Sturba. And let me just tell you this brief story. We had a program here about a year ago about the disaccreditation and the legacy. And there was a lot of discussion about what happened and all of that. But one thing that came out that I really didn't appreciate is that there is a quality that we believe in this community about psychoanalysis, and that we have a group of people who truly love this profession and this work. And this is what they talked about Richard, you know, with all the problems that he had here, his charismatic love for this profession. So I don't know exactly what I'm asking of you, but could you make some comment? You were with them for the last 20 years of their life.
I met them in about 61.
Okay. So what can you say?
Well, I'll start with a personal comment. When I was telling my family that I was coming to Detroit for this week, we were joking about it, and I said, you know, anywhere else in the United States, I'm a distinguished psychoanalyst and psychiatrist. When I go to Detroit, everyone uses that phrase, but that's not what they think when they meet me. My identity in Detroit is the Sturba's son-in-law, and all the rest is secondary. When earlier in my career, when they were alive here, I would get invitations to speak, give grand rounds, and to give talks to the Institute or the Psychiatric Institute. And we always knew that those were engineered behind the scenes. And it had nothing to do with me. It was so the Sturbas could visit their grandchildren. I was only the vehicle for bringing their daughter and grandchildren back to them. I never had any professional relationship with Richard or Dita. I was their son-in-law. And we had a very warm friendship. Richard and I wrote one paper together, which was great fun. I was invited to write an encyclopedia piece for Encyclopedia for Adolescents, biographical encyclopedia, the article on Freud. And Richard and I, over a summer vacation when we were staying together, wrote a biographical note on Sigmund Freud for a biographical encyclopedia for adolescence. Between his, I did the typing. Richard knew the stories, and it was fun. My sense was that they were immensely identified with and enthusiastic about psychoanalysis, sometimes unquestioningly, totally, with a kind of immersion that you rarely see in American-trained analysts, but was part of their world. They lived, breathed, ate, slept, and were psychoanalysts for many, many, many years. I helped Richard, at the end of his life, edit his final paper, which was published just after he died in the International Journal. And they had a little footnote in, as I remember. It was 60 years after the same journal published his first paper. There are not too many people who publish papers in the same journal 60 years apart. I also played a funny role in the writing of his last book, The Reminiscences of a Viennese Analyst. It was late in Richard's life, and he wanted to write it, but he told me he was concerned. He was going to write it, calling it The History of Psychoanalysis in Vienna, or some similar title, but he didn't feel up to the library research and work involved in checking his memory of dates and people and times, and didn't want to write a book that would be incorrect. And he was almost going to give up the project. And I came up with what I think was a brilliant notion that saved it. I said, why don't you call the book Reminiscences? And then any error you make is part of the data, since all you're saying is that's the way you remember it. And that's how we published it. It became a joke. I think Richard loved the field. I think one of his impacts on Detroit, as I see it, is his indifference to whether people were MDs or PhDs or no Ds at all, but his insistence that they be talented and devoted and insightful and gifted gave a special stamp that has continued to influence the community today.
Absolutely.
And I think in a very valuable way. I think his personal fascination with what we now call applied psychoanalysis. He was a gifted violinist. He loved art. And for him, psychoanalytic thinking was a way to open one's eyes and ears and mind to new aspects of artistic experience. And Dita's interest in child development and in working with community agencies in that area both had, I suspect, were in some way precursors to the outreach interests of this psychoanalytic community. Their love of the field was infectious, and I think it was an infection that's become an epidemic around here.
Well, I think that is, and it's intergenerational. One of the concerns that I hear spoken about in terms of the newer generation of psychoanalysts, the candidates, the applicants, is how do we imbue this generation with the kind of enthusiasm and commitment that I guess goes right down to the genes that you described in these two Viennese people who were your in-laws. How do we do that? Is it really a concern, or is this simply a typical generational concern about the young'uns are not as devoted as the old-timers like we are? What thoughts do you have about that?
I'm sure that part of what we feel is a typical generational concern. It seems to me that the important thing in developing that is a certain critical immersion in the experience at an early transforming point in one's career. I think that what we have to do is make sure that we provide our candidates with a chance to do analysis, to be in analysis, and to feel its power and beauty and fascination enough to infect them with it. If we do that, it happens. It seems to me that what we have to keep our eye on is that in the growth of enthusiasm for the many derivatives of analysis, its application in psychotherapy, in teaching, in other treatments, in other settings, that we don't dilute the core so that it loses that compelling power. The beginning of one's career has to have a critical mass of being an analyst in it, or one loses the identification in some way. And we have to keep our eye on our curricula and on our early career tracks to make sure that before people are too involved in those other things, in being a dean, or a teacher, or working in a community clinic, or doing psychotherapy, all of which are wonderful things for analysts to do, that they've done enough analysis, and they've done real analysis with enough intensity and frequency and with a patient population that are appropriate to feel its power and what it is. I think it's possible in some of our administrative enthusiasms to dilute that to a point where we risk losing that identity-forming stage in the careers of our candidates.
What thoughts do you have about what point that is? Because this is what we're all concerned about here. How far are we going, and where does the line need to be drawn?
I think a reasonable case can be made that if someone doesn't spend half of one's time for 5 or 6 years doing analysis, it's at least 4 times a week with patients that are within the range of those analyzable by a predominantly analytic method without parameters and variations that make the dominant treatment less than analytic or different than analytic. We need that kind of exposure. The critical issue isn't quantity, but the only one you can talk about is quantity. The others are harder to articulate. It requires supervisors who know how to teach analysis rather than to make sure the patient gets adequate treatment, and no more than that. There are many patients who can be well treated and helped by analytic candidates without an analysis ever occurring. If we settle for that, we will be responsible clinicians providing service to the community, teaching our candidates how to do psychotherapy, and we won't create another generation of analysts.
Well, I think that we're coming to the end. Thank you, Robert Michaels. You have been an inspiration and a source of knowledge to all of us.
Thank you. It's been a full, busy, and exciting week in Detroit.
Good.